Welcome to the Kaleidoscope, Healthcare in a Diverse America, from molecule to market, with your host, Sheila Thorne. Each episode highlights healthcare leaders and patients of color to discuss culturally, linguistically appropriate strategies and services. You can find this show on all major platforms, including YouTube, LinkedIn, Apple Podcasts, Spotify, and on our website, SheilaThorne.com. Now here's the host of the Kaleidoscope, Sheila Thorne.
Hello, good afternoon, and welcome to the Kaleidoscope. April is National Minority Health Month. And as I was preparing for our program today, I couldn't help but reflect on the last decade that I've been working in this space that talks about how much progress we've made in the elimination of racial and ethnic health disparities. I've had some amazing experiences. I've been working with some incredible people who are committed to reducing and, more importantly, eliminating racial and ethnic health disparities. So it's my pleasure today to take some time to reflect on exactly how far we've come. And in so doing, I couldn't help but think about a quote that I think very, very appropriately describes exactly what this time means to, or should mean to, all of us. And it's a quote from Charles Dickens' book, A Tale of Two Cities. And when you think about A Tale of Two Cities in this quote, I think you'll understand what I mean. It was the best of times. It was the worst of times. It was the age of wisdom. It was the age of foolishness. It was the epic of belief. It was the epic of incredulity. It was the season of light. It was the season of darkness. It was the spring of hope. It was the winter of despair. As I think back over the 27 years I've been working in the multicultural space, this quote aptly describes my feelings today. The best of times, because at least now, as I talk to many of my colleagues and friends in the healthcare industry, race, ethnicity, and health is on the agenda. I no longer have to force it to be a part of the conversation. It is less uncomfortable for so many people to talk about race, ethnicity, culture, and health. But it's the worst of times because there are still far too many who have not embraced culture and diversity and equity as much as they should. It is the worst of times because not too many have put enough resources behind our efforts to strive for health equity and to actually get results. It was the age of wisdom, because we're living in the time where the Affordable Care Act has made a tremendous and significant difference in the lives of so many Americans, because now so many have access to quality, affordable health care. It's not perfect, but we're still working on it. It was the age of foolishness, when there are so many forces out there that are trying to cancel culture, ban books, diminish race and ethnicity, and unfortunately, they don't celebrate diversity. It was the epic of belief. Well, it's my belief and my team's belief and others like us that we can achieve health equity. It is not elusive. It is not a dream. It is definitely doable and achievable. It's a season of light because obviously now we're at a position when we can really do something about racial and ethnic health disparities. It's no longer just philosophic or academic. It is something that's real and tangible, measurable, and sustainable. It's a season of darkness because there is still far too many people of color who are in poverty, who lack adequate insurance, who lack health insurance. So we still have to work on making sure that all of us have equal opportunities. But it is indeed a spring of hope because we're here having this conversation, and hopefully so many of you are working with your teams in your companies and in your organizations, striving to do a better job of how to reach out and engage communities of color, how to empower and educate people to take charge and control of their health, people of color. And we are using all of our means, technology, print media, social media, community events, community forums, to help people understand that they have a role to play in their health, of their families, and of their community. But it also is the winter of despair because the forces that are gathering to diminish culture, to say that diversity is not a good thing, it doesn't work, it's not an asset, is still hovering over us. So let me read that quote again and think about healthcare reform and health disparities. It was the best of times, it was the worst of times. It was the age of wisdom, it was the age of foolishness. It was the epic of belief, and it was the epic of incredulity. It was a season of light, it was a season of darkness. It was the spring of hope, it was the winter of despair. So here we are, still struggling, still striving, and clearly many have gathered us, many have joined the voice of the patients who need our support, need our help, need information, and need the resources necessary to have quality health. COVID-19 and the national racial justice movement around the world has heightened the focus on racial and ethnic health disparities. But unfortunately, disparities are rooted in racism and prejudice. And this has really fueled racial and ethnic health disparities. So we have to take a look not only at the disease and the condition, but at the broader societal problems. Health equity is so that everybody can achieve their highest level of health. And that's what we are striving for. But where are you on the cultural competence continuum? The continuum starts with destructiveness. Those are people who cancel culture and want to destroy culture and eliminate difference. Or maybe you're at the level of incapacity. If you've only grown up with people who look like you, work with people who look like you, live in a neighborhood of people who look like you, and you're not of color, you may not understand what it's like for me to live in my skin. Or maybe it's pre-competence. You know there's something you've got to do. You know that things have to be done differently, but you may not have the capacity to actually execute the programs. I hope that more of you are on the level of competence. You look at what you're doing, you design your strategies, your campaigns, your programs, your media, your messaging, your images to know that things must be done differently. One size does not fit all. If you're at that level, that makes it more promising that we can achieve health equity. But what we're striving for is competence and going beyond that to proficiency. How can we do a better job of making sure that we reach out to everyone, regardless of what language they speak, what they look like, or where they come from? Competence and proficiency means you've made a commitment personally with your colleagues, your brand team, your division, your department, your organization. You've made a commitment that racial, ethnic diversity is on the table. It's part of the conversation. You may not know always what to do about it, but it's being talked about. You're courageous, you're being brave, and you are being disruptive of doing it the same old way, which never got good results. So National Minority Health Month is a time for us to reflect on all of these issues. And we're going to show you a video that my team and I produced to give you a little history about where National Minority Health came from and how it has become an annual opportunity to reflect on the elimination of racial disparities. Let's show the video. I think we're missing sound, Sarah. Why don't we stop it and go back to the beginning as you're trying to figure out the sound? Okay, thank you. The video that you're going to see, it was produced in 2002, and that was the year that actually Congress designated April as National Minority Health Month. And as you'll hear in the video, hopefully we can make it work. That was the time when I had the privilege of working with the team who was actually responsible for drafting the resolution so that Congress could put it into the congressional record, designating April as National Minority Health Month. Now, there were some states who were already celebrating National Minority Health Month, but this now became official for the federal offices of minority health and the state offices of minority health to join with the program. All right, let's try it again, Sarah. In 2002, the United States Congress declared that a National Minority Health Month should be established to focus on the disproportionate impact of disease, disability, and premature death in people of color in America. I had the privilege of being a member of the task force under the direction of the 16th United States Surgeon General, Dr. David Satcher, to draft the resolution and submit it for inclusion in a congressional record, designating April as National Minority Health Month. The resolution encouraged and challenged all health organizations, all Americans, to develop and conduct programs and activities to promote healthfulness in communities of color. Hello, I'm Sheila Thorne. To all of you who are healthcare executives, providers, clinicians, researchers, caregivers, and patient advocates, welcome to National Minority Health Month. When it comes to the health status, disease burden, health outcomes, and mortality data of people of color in America, the data are irrefutable. The data are clear. The data are alarming, and there is no debate. People of color in America get sick more frequently, are screened for illness less often, are diagnosed later, and are treated less aggressively and buried earlier than other ethnic groups. Health disparities, differences in disease burden and outcomes. Health care disparities, differences in access and quality of care, both are pervasive and persistent across a broad range of therapeutic categories and in a variety of healthcare delivery settings, even among the middle class and insured. Sadly, the health data of people of color has been the same since health data of racially diverse populations have been collected. From the moment the first Africans set foot on the ground in Virginia in 1619, racism, discrimination, and bias have continued unabated. Racism, discrimination, and bias in the United States have been imposed by legislation, have been supported by big business, enshrined in government policy, enforced by the U.S. criminal justice system, and legitimized and made acceptable by bigots. Although many find it hard to believe, and many even reject the idea, racism, bias, and discrimination permeate America's healthcare system and has fueled health disparities. During a congressional hearing, Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, said, "Institutional racism is a contributing factor to why Black communities have suffered disproportionately during the coronavirus pandemic compared to white communities." Centers for Disease Control Director Dr. Rochelle Walensky recently stated, "COVID-19 illuminated inequities that have existed for generations and revealed for all of America a known but often unaddressed epidemic impacting public health, racism. All you need do is to listen to the stories of patients of color, as I have done for almost 3 decades, and you would be forced to conclude that inequality and societal inequities are indeed making people of color in America sick." In 1915, shortly before his death, Booker T. Washington launched the National Health Improvement Week, which later became known as National Negro Health Week, and was celebrated from 1915 to 1951. National Negro Health Week stands as one of the longest sustained health promotion and disease prevention campaigns for Black Americans in public health history. Well, in 2002, it was time to reinvent, re-energize, and revive the spirit of National Negro Health Week and make it more inclusive of other communities of color. So now we have National Minority Health Month, even though the term minority is marginalizing and not the preferred label for people of color. And it's time again to step off the road and cut a brand new path. Why now? Because on March 11, 2020, the Director General of the World Health Organization declared COVID-19 a global pandemic. COVID-19 has glaringly illuminated persistent and pervasive health and healthcare disparities. On March 11, 2020, the world came to a standstill. 2020 was a year of fear of this novel coronavirus, unfathomable deaths, confusion, and misinformation, but it was also a wake-up call to healthcare professionals. While the pandemic has had a dramatic and devastating impact all over the world, distressing, alarming health data about people of color emerged in the United States. COVID-19 has hit communities of color very hard. People of color in America, especially African American, Hispanic Americans, and Native Americans, experience more infections, more serious illness, more hospitalization, and more deaths
and white people. While many were shocked and alarmed, this came as no surprise to enlightened members of the public health community and providers of color. So now here we are. I am here to issue a call to action during National Minority Health Month for all stakeholders, clinicians, providers, researchers, patient advocates, policymakers, to join together, to work together, to eliminate racial and ethnic disparities. What better moment in history to begin to seriously, consistently, realistically, and cultural competently address long-standing health and healthcare disparities. The reasons for healthcare disparities are complex, so the solutions are not simple. The most unprecedented global collaboration in history of scientists, pharmaceutical, and biotech companies show us what real collaboration can accomplish. Let's have courageous, uncomfortable, and inclusive conversations to find solutions. Because your health status and health outcomes should not depend upon your zip code, what you look like, what language you speak, or where you come from.
Quality, affordable, accessible, equitable, culturally competent healthcare is not a privilege. It is a civil right.
Happy National Minority Health Month.
So, ladies and gentlemen, where are you during this National Minority Health Month? Where are you on the cultural competence continuum? How are you designing your campaigns, your programs, your media messages, your social media campaigns to address the diversity and the beauty of the diversity of America, so that people of African, Hispanic, Latino, Asian, and Native American descent can take charge and control of your health? Are you still stuck in a pilot market mentality where you have limited resources to do a 6-month program and expect results? It's never going to happen. Has your senior management seen fit to really set aside sufficient resources commensurate with the need and the opportunity? Do you show up at Ethnic Medical Society Association and society meetings, the National Medical Association, the National Hispanic Medical Association, the Asia Pacific Islander American Health Forum? Are you there? Or do you just send a booth or send materials and nobody shows up? You've got to show up, because that will help build trust. That will help diminish mistrust and distrust. You need to be there to speak up and speak out in your support about diverse communities. As you're putting your brand plans together for 2025, have you included some kind of program that will focus on ethnicity and diversity with regard to the disease state or condition you're working on? When you put together your clinical advisory boards, are you looking for physicians and nurses and pharmacists of color to be the voice and the face and the messenger of communities of color, because they're trusted? So where does the diversity start? Is your team diverse? Are you really working hard on getting people of color within your ranks who can speak to their lived experience about health and healthcare? So where's your cultural consciousness? Are you aware? Or is it only in Black History Month or Hispanic Heritage Month or Asian Pacific Islander Heritage Month or Native American Heritage Month? This is a journey. This is not a month program. This is not a 30-day, 90-day enterprise, and you think you're going to get results. It just won't happen. Have you made a commitment? Have you become culturally conscious and reached out to experts who know how to do this well? Have you put aside sufficient resources to begin building relationships in the community so that you can take down those barriers of mistrust and distrust? So clearly, you have to ask a lot of questions of yourself and your team and your management and your division, because many are still at that level of cultural incompetence. It's time to step off the road and cut a brand new path. So take it from diversity training to diversity education. And don't look at race as a barrier. Look at it as an asset. So you celebrate difference, which is what our country is built on. It's our greatest asset, but apparently it seems to be one of our greatest challenges. But in healthcare, you clearly have to make a difference. And you have to make a difference where it's going to reach the community on the grassroots level. Top down, yes. Bottom up, extremely important. churches, bodegas, beauty salons, barbershops. Meet the community where they're at. Assign either members of your group or get partners in the room who can help you walk together in those communities. So National Minority Health Month is a time for you to reflect. Where were you last year? Where are you now? Where do you want to be next year? That's the charge I'm going to give you. That's the call to action. Not philanthropic, not philosophical, but tactical, strategic, thoughtful, mindful, and meaningful, so that we all can achieve our optimum health. So I'll close with the quote from Charles Dickens, A Tale of Two Cities. Reflect on this quote in terms of where you are on the cultural competence continuum as you look back over the last 5 or 10 years, or even just last year. It was the best of times. It was the worst of times. It was the age of wisdom. It was the age of foolishness. It was the epic of belief. It was the epic of incredulity. It was a season of light. It was a season of darkness. It was the spring of hope. It was the winter of despair. So let us all join together and collectively make it our commitment and raise our consciousness so that we can talk next year about how we have put our foot to the metal to eliminate racial and ethnic health disparities. Thank you. And let's see next year in National Minority Health Month where you are on the cultural competence continuum. Thank you. National Minority Health Month this year, the theme is Be the Source of Better Health. And that's the theme that we're going to follow through this year. Next slide, please. And your community is really what it's about, and that's the grassroots level. So we really want to make sure that we are reaching into community, boots on the ground, feet on the street. Yes, it's important to talk to all healthcare professionals, physicians, nurses, social workers, nurse practitioners, physician assistants, all of those who are part of the coordinated care team. Next slide. And this is the real bottom line. Every community deserves good health. It is not a privilege. It's a civil right. So it's something that we have to educate and empower people to strive for. Next slide. The theme for 2024, Be the Source for Better Health, improving health outcomes through our cultures, communities, and connections. It's about understanding how the unique environments, cultures, histories, and circumstances of racial and ethnic minority and American Indian and Alaska Native populations impact our overall health. It's about addressing and acknowledging the role of social determinants, where we live, work, pray, and play. There is a pressing need to equip individuals with the resources and knowledge to advance health equity through policies, programs, and practices addressing the social determinants of health. So it's time to step off the road and cut a brand new path. Welcome to National Minority Health Month.
You've been tuning into the Kaleidoscope, Healthcare in a Diverse America from Molecule to Market, with your host, Sheila Thorne. You can find more episodes on all the major platforms, including YouTube, LinkedIn, Apple Podcasts, Spotify, and on our website, SheilaThorne.com. Thank you for your positive reviews, comments, questions, and for sharing this show with others.